Hi, it's Dr. Jerome Fryer. Have you ever had back pain that starts on one side and then somehow seems to shift and move over to the other side? Well, if this is what you're experiencing after a particular event, a bending forward movement, one of the things that often causes those symptoms is, if you look at the spine model here, the disc is on the front. A bending forward activity can actually compress. It's like what happens is the disc actually goes down just a little bit, because inside here there are annular tears, so the nucleus pushes back. So there's it's like a house shifting. It comes down. So with that, if you look on the back side, if it drops a little bit, you can see that actually these joints, these facet joints, have to drop as well. They're used to a certain space. But what happens is if they drop, now they have to find a new groove pattern associated with the cartilage within here. And they're not always symmetric. Very rarely is there symmetry. You can see here how the angles, this is actually how one's this way and this one's a little bit more this way. Well, this is actually called tropism, where there's actually two different angles. So what happens sometimes is when the disc height goes down, the cartilage has to find a new sort of a groove pattern. And underneath the cartilage, underneath the blue, you can see there's this red. And that's where these nerves exist. The blue, the cartilage, which is about 0.5 mil thick, doesn't have any nerves in it. But underneath there's nerves. So it's like a little divot that gets there's a little bit of a fissure. We call them fibrillations, or a little kind of a crack. Think of it like a crack in the earth, right? It's kind of a little crack, and then the nerves are there. So it takes a little while for the cartilage to actually regenerate and kind of fill, because the cartilage is slowly rebuilding. In cases where this is chronic and people are not really understanding what's going on, they continue to do the wrong movements, and it can develop into things called an osteophyte or osteophytosis, where the body has to try and build up the calcification here to try and buttress the extra forces that are coming down. So if you've had back pain and it moves from one side and then goes to the other, and you can feel a little bit more when you bend backwards, it's very likely that it's the facets that are causing your symptoms due to subtle disc height loss.